HITECH Compliance, how to effectively manage the security and compliance status for your business associates and subcontractors. Today's presenter is Anupam Sahai, co-founder and president of eGestalt. Anupam is an accomplished management, marketing, and technology leader with 21 plus years of experience directing teams to develop and launch globally renowned products generating up to $350 million annually. Prior to eGestalt, Anupam was Vice President Marketing for Ixia Inc. He is a recognized expert in the areas of healthcare IT, cloud computing, security and compliance, networking, and is also a featured speaker at several industry conferences worldwide. Today we wanted to tailor this webinar a bit more, and our future webinars as well, to suit our audience's demographics. So we have 3 poll questions that we're going to launch right now, and you can see them in your GoToWebinar admin panel there, or your GoToWebinar panel. Let me launch the first one, and the question for this poll is, what is your current status? Covered entity, business associate, service provider, or other? Feel free to answer this poll question. This will help us tailor this webinar and all of our future webinars as well. I will close the poll in 5 seconds. Okay, the poll is closed, and our results. What is your current status? 47% are a covered entity, and 41% are a service provider, with 24% business associates. Okay, the next question is, what is your position? What is your position or your role at your company? Executive, compliance-related, risk, privacy-related, IT-related, or other? Or as I put, others, I guess, should be other. I will close it. It's pretty close. I'll close it in 5 seconds here. So Anupam, it looks like we have a pretty good mix here. 60% are compliance-related, with 40% executive, 45% IT-related, and 35% risk, privacy-related. So pretty evenly distributed. The last question, have you undergone a security risk analysis? Simple question, yes or no. Go ahead and answer that, and I will close it. Looks like we have close to 100% participation, so I'll close it right now. Pretty close, 55% yes, 45% no for the question, have you undergone a security risk analysis? So Anupam, I hope this gives you a lot of information here and helps you tailor this webinar. To our attendees, if you have any questions, please send them via the questions function, and I'll get them answered by Anupam at the end of the webinar. If you'd like a copy of the presentation, send an email to Anupam. His contact information will be given at the end of this webinar. Thanks again, Anupam, for presenting, and I'll turn the webinar over to you now.
Thank you, Mike. Good morning and good afternoon. So in terms of what I'm going to cover today, I'll talk about HIPAA HITECH requirements and provide some background on Omnibus and the new rule changes that have come in. And then I'll focus in on some of the requirements for dealing with business associates and subcontractors, which is really the focus of the presentation today. I have other webinars that cover overall requirements, etc. But today we are focused on dealing with requirements for ensuring coverage with BAs and subcontractors. And then I'll talk about the best practices in terms of putting together a vendor management program, and I'll talk about 7 questions that you need to ask BAs and vendors if you're a covered entity or a service provider, or if you're a BA, then you need to ask these questions to a vendor that or a subcontractor that works with you. And I'll cover that, and then I'll talk about AG5 Secure GRC, which allows you to automate not only the end-to-end security and compliance posture for a covered entity, but also for a business associate and subcontractors, and allows you to put together an automated vendor management program for HIPAA HITECH. And then finally, I'll conclude with Q&A. So before I start, let me just put some standard disclaimers that information about HIPAA HITECH is continuously evolving, and the information is subject to change. While I've made best efforts to ensure that the information is up to date, but this is subject to multiple interpretations and is certainly subjective. So please consult with your legal counsel, auditors, or advisors to ensure everything is up to date. Before I jump into the background, I will be using certain acronyms, and I want to make sure that everybody is on the same page with respect to the vocabulary. So HHS stands for Health and Human Services. OCR is the enforcement agency of HHS that's responsible for ensuring HIPAA HITECH compliance. PHI and EPHI is going to be used interchangeably. EPHI stands for Electronic PHI, Protected Health Information, and PHI, of course, Protected Health Information. And CE stands for Covered Entity, and BA is short for Business Associate. So let's jump right in. What does a covered entity mean? A covered entity is any of these providers following in one of the three categories shown here. It could be a healthcare provider, which includes doctors, clinics, psychologists, dentists, chiropractors, what have you. And as long as they transmit any information in electronic form in a transaction with HHS, whether it's Medicare, Medicaid, they are a covered entity. Or a covered entity could be a health plan, which includes HMOs and government plans, or it could be a healthcare clearinghouse, which are essentially exchanges responsible for sharing and processing information. So a covered entity could be any one of the following categories of providers. A business associate, this is where the definition really gets enlarged a lot, is really anybody who accesses PHI from a covered entity and does any processing. And anybody who accesses PHI, any business or entity, is really bound by the same regulations as the customers that are served by covered entities who's primarily interacting with the end customer or patients in this case. Oops. Sorry about that. Let's see what happened here. Apologize for this. Looks like something popped up here. Okay, there you go. So here are some examples of business associates that are in the purview of the definition. A business associate could be somebody who's an IT service provider who's hosting patients or doctors' infrastructure or covered entities infrastructure. It could be MSP. It could be an accountant, legal folks, legal businesses who are counseling covered entities or dealing with patient information. It could be EMR providers. It could even be garbage collectors who are responsible for disposing of PHI information. So anybody and everybody who touches and is involved in dealing with PHI information is in scope of being a business associate. So having defined what a covered entity and what a business associate entities look like, let me jump into some of the latest changes that have come about as a result of HITECH Act, which was part of the Recovery Act in 2009, and then the HIPAA Omnibus rules, which were released in January of 2013, and which basically come into effect from the enforcement perspective in September this year. And there's some absolute game changers with respect to not just the overall HIPAA HITECH, but also in terms of how business associates and subcontractors roles are and what they need to do to ensure compliance with HIPAA HITECH. So some of the key changes from HITECH and HIPAA Omnibus reinforces that is the ability of OCR and HHS to conduct periodic audits. And the audits can be conducted for not just covered entities, but also business associates and subcontractors. So the scope of audits covers both BAs and subcontractors. The other change which came about with HITECH, but also has been reinforced with HIPAA Omnibus, is the notion of non-compliance and willful neglect, which means that if you know that you need to be compliant with HIPAA HITECH and don't take sufficient steps to demonstrate what is called reasonable effort towards compliance, then there are fines and potential criminal liabilities that come about. And one of the clarifications from HIPAA Omnibus is that while $1.5 million is the maximum fine, but it's only per incident category. So in a sense, if a business is responsible and is liable or found to be defaulting on multiple incidents, the upper limit to fines are not really there. And then there are clauses in HITECH and HIPAA Omnibus that essentially allows whistleblowers and enforcement agencies to share the fines that are found to fund the agencies and also to reward whistleblowers in case they find entities that are not following HIPAA HITECH or not following the privacy and security practices. And then state auditor generals can also act on behalf of the citizens in terms of conducting audits and bringing about civil action lawsuits if necessary. Now the two bigger definition or the scope changes are really one of the key parts is that business associates now have a complete responsibility along with the covered entities to ensure that they are complying with HIPAA HITECH laws, that they're protecting PHIs, and there's a liability chain in place, which means that covered entities are responsible and liable for protecting PHI. But not only that, as business associates and subcontractors use the PHI, BAs also have a shared liability, and there's a liability chain in place to ensure protection of PHI. So the scope of HIPAA HITECH influence and enforcement extends beyond covered entities. It includes business associates and subcontractors. And thereby, the data breach notification requirements also requires that business associates and subcontractors are informing the covered entities who needs to inform HHS in case a breach happens. And HIPAA Omnibus has clarified certain conditions under which this breach notification needs to be made. Pretty much you can assume that if there's a breach, then the liability of reporting a breach is pretty much there. So if there's a breach, business associates and subcontractors need to report the breach to covered entities who need to report to HHS. So that ambiguity was clarified with HIPAA Omnibus. Earlier there used to be a risk or a harm clause, which has been clarified. So as you can see that the scope of HIPAA HITECH includes the covered entities and the business associates and the subcontractors. So there are roughly about 700,000 covered entities. There are literally millions of BAs who work with covered entities and deal with PHI, which need to be compliant. And of course, in order to provide and facilitate the adoption of HITECH and adoption of electronic medical records, which is part of HITECH, the government has put together a stimulus money which requires providers to demonstrate that they have implemented HIPAA HITECH and also demonstrate what is called meaningful use, which is nothing more than ensuring that the patient health information is being used and shared properly by keeping into account all privacy and security practices. So again, I won't touch upon that in the presentation today, but this is more for FYI. So HHS maintains a website which is also called sometimes the Wall of Shame, wherein any and all breaches are reported by covered entities. And you can look at this website and you'll find that entities of all sizes and all types, so covered entities, BAs, subcontractors, have entries here. So the breaches are pretty pervasive, and partly because the cyber attackers are getting more organized, they're very sophisticated, and sometimes the targets are small to medium businesses who may or may not have the wherewithal or the IT resources to defend themselves. But even large hospitals, large healthcare entities are under attack. And so there's a huge set of infrastructure upgrade issue that everybody is kind of racing towards. And as I said, breaches are pervasive, which means that entities both small and large are affected. Here are some example clips of Blue Cross, Stanford, TRICARE. These are big entities, big hospitals, and big healthcare providers or insurance providers and healthcare plan providers who are affected. And what breaches lead to are not only fines and potential criminal prosecution by the federal agencies, but also brings about lawsuits from the patients whose records have been compromised. So it's a huge loss of reputation. There's probably fiscal liability and responsibility, etc., that comes about, not to mention the brand damage. And if you look at the stats from HHS, pretty much millions of records are being affected. State-level breaches happened, Utah, Alaska, and the latest breach tally as of March 25th, 2013 involves roughly about 21.7 million individuals with about 600 odd breaches. So it's a big number. And there's a monthly tally that's maintained by the HHS website. And if you look at the monthly running total here, for example, in Jan 2013, there were about 700 breaches, and the numbers vary from 700 to 990 breaches per month. And about 26% of those breaches are enforceable, which means they get penalized, etc. And so it's a very commonly occurring situation, unfortunately, wherein healthcare entities are getting hacked and breached. And it's not just the healthcare entities, but business associates. These are entities that work with covered entities are responsible for about roughly 50% of the breaches. So the problem is extending itself in the form of not just covered entities being affected, but BAs and subcontractors are also part of the impact loop here and the liability impact here. So what needs to be protected? Let's dive a little bit into that, and that will give us a sense of how much effort is needed and what needs to be done to protect it. So PHI, the scope of PHI includes individual health information, it includes personal information, or anything that might lead to an individual. So name, address, birth date, social security number, and any health record that's associated with the individual is construed to be PHI and needs to be protected. And this PHI information could be in electronic form or it could be in physical form, which means when you walk into a doctor's office, you see those stacks of files with patient information. All of them are getting converted to EMR with time, but as they're getting transitioned, both the physical and electronic versions of those file information needs to be protected. And it needs to be protected to ensure that as the information is stored, as information is transmitted, it needs to be secured, and it needs to ensure privacy and security of the PHI information. So if you're a covered entity, what do I do? And what can I do to ensure that I'm taking care of my responsibility in terms of how I deal with BAs and vendors? So as I said earlier, as a covered entity, I have a responsibility, I have a shared responsibility along with BAs and subcontractors to implement HITECH. So I need to implement HIPAA HITECH requirements. I need to ensure all the policy safeguards, all the technical safeguards, all the requirements, the controls that are required by HIPAA HITECH are implemented. But I have a responsibility to ensure any downstream BAs or subcontractors that I've worked with are also protecting the PHI information passed on to them. And that can be ensured in some sense by having a business associate agreement, which is really an agreement between me and the downstream folks to ensure that there is a contractual obligation put in place and there are mechanisms put in place to ensure that BAs and subcontractors downstream are protecting the PHI information. And that includes that they have a risk management program in place. They have put together risk and privacy of PHI procedures, that they have put together a breach notification plan, and I need to dovetail my breach notification plan with the downstream BAs and subcontractors. And then if I'm interested in getting federal grants, then I need to do all of this, show all of this in a report and compliance submission along with the security risk analysis. So these are my basic high-level requirements, and of course these are part of practices that allows me to be compliant with HIPAA HITECH, but this is also the beginnings of a security and compliance program that overall will protect me not just from HIPAA HITECH audits, but also from making sure that cyber attackers are not able to breach my infrastructure. Because at the end of the day, compliance is a set of security best practices to protect PHI, as is the case with HIPAA. In the case of PCI, compliance is really security best practices to protect credit card information, et cetera, et cetera. So compliance are protecting a particular asset, and there are a bunch of security practices that are required as part of the standard or regulation, whatever be the case. So if I'm a BA, if I'm a business associate, I have a set of responsibilities, which is that I need to be aware of my responsibilities, which is shared responsibility with the covered entity upstream, that I need to implement HIPAA HITECH, I need to implement all the privacy and security laws to protect PHI information. And then if I work with any downstream vendors or subcontractors, I need to ensure that I put together an agreement with my subcontractors to ensure that they report any breaches, they report any misuse of data, which I then need to report upstream to my covered entity that I work with. And putting together a breach notification plan to the upstream entity, which is covered entities, is also required. So as a BA, I'm required to be HIPAA HITECH compliant as well. I need to put together a set of best practices and implement agreements and implement HIPAA HITECH practices that makes me secure and compliant, just like a covered entity would do. And in many respects, the HIPAA HITECH requirements are very similar. There's some differences between what a covered entity needs and what a BA needs, and but for the most part, they are very similar. So those were the responsibilities and requirements from the CE and BA perspective, and I want to jump a little bit more deeper into the important questions that a covered entity needs to ask BAs and external vendors to ensure that the PHI information is being protected. And there are 7 questions that need to be asked. So the first question that a covered entity needs to ask a BA or subcontractor is that, have you done a self-assessment, and do you have any proof of HIPAA HITECH compliance? And if you did that, if gaps were found, if risks were associated with those gaps that were found, how did you go about fixing it? And who was the auditor? Can you give me details about it? It's a fair question to ask by a covered entity to a BA. And this basically gives comfort to covered entity and provides documentary evidence that the covered entity took reasonable efforts to ensure BAs are complying with the law and protecting PHI, so that when they get audited, they'll have documentary evidence of that. The follow-up question is that did the BA do a risk assessment, and what was the result of it? And the risk assessment really is about understanding and mitigating the most gaps that were found in the infrastructure vis-a-vis the HIPAA HITECH requirements, and asking questions about remote access of data, asking questions about how telecommuters access the data, and those questions are important. If you look at some of the recent breaches, like Stanford breach happened because one of the business associates published the data unknowingly on a website, and they were sitting in a car in a parking lot when they posted the data, and this was done unknowingly because they were able to remotely access the data. So asking the mobility question, asking the remote access question is important, and this is all part of risk assessment that a BA needs to do. And so asking the risk assessment question is very, very important. Also ensuring that all employees that join the business associate, whether they've been trained in the HIPAA HITECH requirements, they've been trained in social media policies, have they been trained in how the information needs to be accessed and shared, and doing some kind of a background check to ensure that they don't have a history of violations from the privacy and security point of view would be good to know. So, and then getting to the details of how the data, how the PHI data will be stored, accessed, shared, and transmitted. Just like a covered entity who has these requirements and controls from HIPAA HITECH, a business associate has a similar set of requirements from HIPAA HITECH as well. And it's well within the rights of a covered entity to ask and solicit that information from a BA, and basically ensuring that BAs are taking care and putting together stringent controls, putting together people, process, and mechanisms in place to ensure safeguarding of PHI data. Training employees about social media policies that I talked about. What are the rights of employees, and what are the rights of patients? What kind of information can be shared? Who can access what kinds of information? All this is part of privacy awareness training. HIPAA HITECH restricts certain kinds of data to be not shared externally without written permission from the patient. So knowing the scope of what data can be used for what purposes with the marketing or other activities, that needs to be clearly, there's a training element to it that needs to be communicated and educated. The employees need to be educated about that. And so that's part of the training program that needs to be implemented. And then in some extreme cases, some covered entities have the leverage with their business associates. Some of them may or may not agree to this, but if they do, some of them might request an on-site review by bringing a third-party auditor. If there's a large hospital who's exposed to like the Stanford or the TRICARE breach that took place, where a $4 billion lawsuit was put on them. So covered entities have a huge liability. So they might have the leverage to bring in an external auditor or an internal auditor who can essentially get a first-hand glimpse of how the PHI information is being taken care of. So all of this is well within the realm of possibilities. Not every BA, as I said, will be open to doing this, but it really is a negotiation between the covered entity and the business associate in terms of what will be allowed or not. But it's well within the rights of a CA to ask this question. And finally, a BA, if they're working with other subcontractors who's going to be handling PHI, the covered entity should demand that they put together a similar set of agreements in place with their subcontractors and to ensure that PHI information is safeguarded downstream from the BA. So these 7 steps are essentially a key set of questions that a covered entity can ask at a high level. And then the next step could be should be to ensure that the BAs are going through a full HIPAA HITECH security and risk analysis. But these are the big ticket items that a covered entity needs to ask a BA to ensure that they are following the law, that they ensure that they are taking the right steps to ensure HIPAA HITECH compliance. So given all this that's going on, now I want to change gear and talk about an automated tool called HIPAA Secure GRC, which allows you not only to look at HIPAA HITECH security and compliance issues for a covered entity, but it allows you to automate this whole process of BA management and subcontractor management. The tool will allow you to remotely manage and probe the BA and the subcontractor compliance status. BAs can also use the tool to become HIPAA HITECH compliant, and the process will help you provide complete visibility into this whole management of liability chain that starts with the covered entity and BAs and subcontractors. So what is HIPAA? HIPAA is a cloud-based GRC tool, IT-GRC tool with built-in security monitoring capability to get you real-time compliance and security status. It supports multiple compliance frameworks. Certainly HIPAA HITECH is one of them, one of the key frameworks that we support. But it also supports PCI, SOX, FISMA, and other frameworks that you might be interested in. It also allows you to do vulnerability management through the cloud. Again, this is a unique integration that the tool has with GRC management, where the vulnerabilities that are found in the infrastructure are mapped to IT-GRC controls, so that you don't have to manually inspect every device and data to ensure that they're not out of compliance. It will be automated through this process. Vendor management and automation of BA management is part of the offering, and it comes pre-packaged with policy and procedure templates, best practices that will guide not just the covered entity but also the business associates and subcontractors with respect to what things they need to put in place to be HIPAA HITECH compliant, to ensure that they are protecting the PHI information and dealing with privacy and security requirements. And doesn't require any hardware. It's completely cloud-based, software-based, so it's much cheaper than anything that's out there. And from the workflow perspective, it supports end-to-end workflow management for complete security and compliance management. And whether it's training, whether it's best practices, policy documents, putting together remediation, communicating to all employees, doing a gap analysis, all of that is possible through the automation process that the tool provides. And the different editions of the tool, depending on size of the business, because a small business, 1 or 2 doctor office practice requirements are very different from a larger hospital. If you're a covered entity versus a business associate, the requirements are different. So you can pick an edition based on your business size and based on your HIPAA HITECH requirements. Excuse me. And the tool scales up from small businesses to larger hospitals, and different editions essentially serve that need. And what the customer, whether it's a covered entity or a business associate, would get is a dashboard like this, where a scanning agent will scan the infrastructure and map it to compliance controls, and you'll get a dashboard which tells you what your compliance status is, what's your security status. And by the way, you can download a free community version of this tool from egestall.com. You can subscribe to it, you can play around with it, and within minutes it will tell you your security and compliance posture. That will allow you to understand what's missing vis-a-vis the requirements. So if you're a covered entity and business associate, you want to know where you stand, you can download the free community version of the tool. It's a diagnostic tool. It will tell you all the issues that are found from the scanning agent scan perspective. So let's jump into BA and vendor management process. How do we go about doing this? How does the tool help you do that? And it's really very simple. You identify the list of BAs and external vendors that need to be managed. You provide a list of them and add it to the tool. Excuse me. The tool will send out what is called a high-scan questionnaire, which is really the 7 steps that I talked about, which map to 20 questions. And these 20 questions will be sent to each of the BAs, and they'll need to answer that question by logging into the tool. And the covered entity will get very quickly initial set of responses from the business associates about their current gaps that exist and the level of HIPAA HITECH compliance status. And typically a covered entity may have anywhere between 10 to 50 business associates. And so what we heard from the field was that it's really a huge pain if we have to go and talk to each of the 50 entities to understand where do they stand. So what this process allows you to do is to really prioritize the BAs that are most exposed through this high-scan questionnaire probe, and then you can work with the higher risk BAs initially, get them to compliance, and then follow that up with the medium to low priority ones. So you're able to manage and stage your BA management process, but the tool will help you guide you and help you throughout the end-to-end process to manage the whole process. And here are some screenshots of how that is done. Literally, you add the email ID of the business associate, add the name, and send out the questionnaires, selecting the users that you pick. And each business associate or a subcontractor will get a list of 20 questions that I said. These are all yes and no questions, and I'll show you that they have copious help, online help, and best practices that enables them to answer these questions. There'll be citation guidance, which tells them how to interpret the requirement. There'll be policy documents that will be available to them. So they need to ask 20 questions, answer 20 questions, which are yes or no form. And at the end of it all, as a covered entity, you'll know what the status of each business associate is. You'll know how many questions have been answered, how many of them have been reviewed. And this is what the assessment questions would look like from a business associate perspective. They'll get yes and no questions with the citation, which is the control that they need to follow, and they can upload evidence to prove to the covered entity that yes, they have implemented this. If they need a policy documentation help, it's right in line with a click of a button, and they can get access to a template, policy template, that allows them to implement this if they're not doing it today. There are BA agreements in place in the tool that a covered entity can modify and use with a business associate, or a business associate could use something similar with their subcontractors. There's a lot of citation guidance, as I said earlier, which is available in line. They have access to best practices, which is essentially what a typical covered entity or a business associate does to implement the requirements, and there's a risk model that's associated with every control. So the tool provides you with complete guidance, complete visibility, and complete implementation guidance as well to educate, to communicate what you need to do if you want to follow the HIPAA HITECH requirements. And it's right there in the tool that typically our channel partners or end customers use to help you complete the whole process. There's also a vulnerability management module that I talked about. This is an add-on module to the compliance, which allows you to know what are the top vulnerabilities that exist and how to go about fixing them. It's right there in the tool with a click of a button. And at the end of it all, there's a report and compliance that's generated, which provides a complete documentary evidence of all the things that were done to ensure HIPAA HITECH compliance. If you have sent out a set of BA requirements, BA high-scan questionnaires to a number of BAs, you'll also have a report in that report on compliance. There'll be a section on which BAs have complied, what's their compliance status. So in this example, there were about 7 BAs that were surveyed, and some of them are very high risk, some of them are high risk, and some of them are moderate risk. It allows you complete visibility based on what you need to do from the next step perspective. So the tool allows you to completely automate not just internal, if you're a CE, not just internal HIPAA high-tech compliance and security requirements, but also for your BAs and subcontractors, thereby allowing you as a covered entity to manage your business liability or the liability chain from the HIPAA high-tech perspective. And there's some sample emails that a covered entity could use to leverage and to ensure that business associates and subcontractors are following the law. So in conclusion, as I said earlier, the covered entity and business associates and subcontractors need to be HIPAA high-tech compliant. This is the law. And they have a shared responsibility in terms of breach notification, in terms of enforcing and protecting PHI. This is also required for getting the federal grant for EMR dollars. Clearly, the downside is if you're not up to speed or not implementing this, there are lots of criminal prosecution, fines, and brand damage issues that come about. So what we recommend is to use the tool to become compliant if you're a covered entity or a BA, or if you're interested in BA management, subcontractor management, vendor management, please, this is one automated way that will help you sleep peacefully at night. And I just want to reiterate that security and compliance is a journey. It's an on-time effort, and the tool will help you manage the ongoing process and the journey. With that, I'll stop right here and let's open it up for questions. Mike? Mike, you there?
Sorry, Nupam, I had myself on mute there. Thanks for presenting, and we'll open it up to questions. If the attendees have any questions, go ahead and ask them in the questions area, or you can ask them in the chat area as well, and I'll get them answered here. Nupam, here's our first question. If we just perform backup services of encrypted data and we do not have access to the data and we are unable to decrypt it, are we really a BA since we have no access to or exposure to PHI?
We'll have to go into the details, but at a high level, and feel free to connect with us offline, but at a high level, if you're handling PHI data, you are in the scope of being a BA. So we'll have to dive into the specific example and case, but seems like you're a BA, absolutely.
How do we get EMR dollars for solely compliance services?
Yeah, so if you're a covered entity, then Medicaid and Medicare would reimburse you for implementing electronic medical records, and to get the dollars, you need to implement HIPAA high-tech compliance services to ensure security and privacy of data. So again, feel free to reach out to us separately and we can talk in detail, but you need to implement EMR, and to implement EMR to get the federal grant, you need to implement HIPAA high-tech security risk analysis, which is the requirement for getting the dollars.
How many CEs are currently using your product, and how many of them do you know have been audited?
We have literally hundreds of CEs and BAs who have used the tool, and I know a number of them who've been audited by third parties, and in fact some of them we were brought in when somebody was getting audited by OCR as well. So we've had multiple situations, and we can talk about that in detail as well if you're interested.
Great. Can you give some pricing for the different product levels? I work with smaller clinics, less than 10, and wanted to give them an estimated cost.
Yeah, so we sell the solution through channel partners, and so the channel partners would typically set the price, but the list price at the entry level for the standard edition, which is typically targeted at smaller businesses of less than 10 doctors, starts at $1,000. This is the compliance software cost, so it's $1,000 per year, and if you want to do vulnerability scanning, that's going to be in addition to that. And then we have an addition for medium-sized businesses and larger hospitals that start at $2,500 per year and $7,500 per year. So depending on the business size, we can come up with a pricing that works for you.
And you're only
These are
channel,
list
right?
prices.
And from your only channel, you don't sell as well. That's one of the follow-up questions here.
Yeah, we sell through the channel only right now.
Okay. Would medical supply companies be considered a BA? What about security camera companies?
Medical supply company, so need some clarification. What kind of medical supply are you talking about? Are you talking about tool providers or medicine providers?
What about security camera companies? Security camera companies. While we ask her to clarify her first question.
Yeah, security camera companies, if they are recording patient visits and anything that's private information that pertains to protecting patient information. In this case, it happens to be personal information. Then my guess is that they are also going to be in the purview of the law.
And can you ask your question about the medical supply companies again, Anupam?
So my question was, what kind of a medical supply are you talking about? Are you talking about a pharmaceutical supply? Or are you talking about a vendor that provides some IT services? That's the clarification that I need. And again, we can take it offline and discuss it if that's of interest to you.
Would emails fall under the 6-year archiving rule? How does the software scan for archived file ages?
That's correct. The archival rules include any email trails that include patient-related exchange of information. Absolutely.
And here's the answer. So she's speaking of vendors supplying the pens, catheters, etc. Maybe it's best. Why don't you reach out to Anupam? His email address is right there, along with his phone number, and he'd be happy to answer your question. Next question: Absolutely. Is there a white label product? Is there a white label product version where logo and brand is used?
Absolutely. So we allow the tool can be rebranded, and it's white labeled today, and channel partners typically put their own brand and co-brand it with our solution today. So the answer is yes.
Okay, great. Thank you, Anupam. Looks like we have no more questions. There is Anupam's contact information on the screen there, so feel free to email him or call him with any questions you might have after this webinar. And we've recorded the webinar as well, so we're going to go ahead and put it up on eGestalt's website at www.egestalt.com, and it should be up there in a day or so. Thank you to the attendees for attending. Stay tuned. We have routine webinars, probably once every month or so, a couple every couple months. So check in on eGestalt's website often, and you'll be able to see the schedule for upcoming webinars. Thank you, Anupam, for presenting, and I'll leave the last word with you.
Well, thank you all for attending, and let us know if you have any questions that we can help answer. Happy to take it offline and answer any questions that you have. Thank you all again for coming. Good afternoon, and thank you.
Thank you, Anupam. Have a great day. Bye-bye.